Hey, did you know all lab results are not normal? You're going, wait a minute, how does that be? You ever get a phone call from your provider, or you've been in your medical provider's office and they go through all the labs and they go, everything is normal, and you don't feel like it is? Well, how do we come up with these normal values? We're going to talk about that. Hi, I'm Dr. Rohn Rigby. I'm a family physician. I'm also a diplomat of the American Board of Obesity Medicine. And we're going to dig into this a little bit and try to give you some tips and tricks of how to do this or figure out what to do. So, what's the issue that normal doesn't mean normal for you? Well, we're a little bit different and everybody's different, so we need to dig deeper. So how do we come up with these normal lab values? Well, the lab tests a lot of people, masses. We check the young, the old, the male, the female, the sick, and the unsick, and they come up with an average normal. Go, see, this is a normal range for majority of people. Well, you're not majority of people. We're trying to get you to feel optimal. So when they say it's normal, you're going, normal for who? Especially if you don't feel good. So my goal is to help you, give you some tools and tips and tricks that can help us understand. So if you don't feel like it's optimal, we gotta dig deeper. So that's the first thing, is not all labs are optimal. And keep that in mind. So if you're feeling like you're off, still might be an issue. Keep in mind, like I said, we're all different. We're like snowflakes. Not that we're weak and we're gonna melt in the heat. It's more of we're all the same characteristic. We're all the same human being, but we're all different. We respond different. We're all a little bit different. So keep that in mind. So just because it's normal for the masses doesn't mean it's normal for you. Also keep in mind that most providers, especially family practice and internal medicine, we do the very basic lab results. And sometimes the basics aren't enough to understand what's going on. So sometimes we might have to dig deeper. So you might have to ask, can we dig deeper? And unfortunately, sometimes providers don't always want to do that. Nothing against them. We're supposed to do what we're trained to do. So they're looking out for you. We just might have to get a second opinion or dig deeper for your health. The main thing you got to remember is that not all medical providers are trained the same. We all go to different medical schools. We all have different trainings. We get taught how the attendings above us, the basic system. We get taught the basics to be able to pass tests. But unfortunately, when we're taking care of patients, this is the practice of medicine. We get to practice on you to try to figure out what's right. Not that we're trying to hurt you. We're just trying to help get you feeling better. But we also need to we all have different interests and different things we're interested about reading about or digging into. So we might have to find something who's trained in metabolic health and wants to learn more about it. And third, keeping in mind those lab values might not be normal for you. So I've tried to create a team that kind of helps you with that. So my call to action for you is threefold. One, ask questions of your provider. Again, keep in mind, be timely, be prepared, understand that you might be asking questions outside their realm. That's totally fine. That's where you need to go get a second opinion or find somebody who's interested in that. Two, remember, not all labs are optimal. They might be normal, not optimal for you. And three, let's fix your metabolic health. Let's get you feeling optimal.